Hi, today is June 28th, 2021. My name is Jasmine Pope, and I'm going to record a video for Professor Nurberg's Adult Health 2 Didactic Theory class or course. And I'm going to talk about a GI disease that is super rare, and it is called Menetrier disease. And there are three different scholarly websites that I'm going to be referring from, and those include the National Center for Advancing Translation Sciences, National Institute of Diabetes and Digestive and Kidney Diseases, and the National Organization for Rare Disorders. First, basically in this video, we're just going to review the pathophysiology, diagnostic testing, clinical manifestations, care that the nurse would provide for these patients. We're going to talk about a treatment plan, medications. We're going to talk about how the nursing process would be implemented, and then patient education. So first things first, let's talk about the pathophysiology. And I obtained this information from the National Institute of Diabetes and Digestive and Kidney Diseases. And basically, Menetrier's disease, it causes the ridges that are along the stomach wall to enlarge. And basically, it forms very large, giant folds in the stomach lining. The ridges enlarge because of the overgrowth of mucus cells in the stomach wall. Now, in a normal stomach like mine or yours, the mucus cells in the ridges, they release protein containing mucus. But the mucus cells in enlarged ridges release too much mucus. So that causes protein to leak from the blood into the stomach. This shortage of protein in the blood is also known as hypoproteinemia. And Menetrier's disease also reduces the number of acid-producing cells in the stomach, which decreases stomach acid. So, how do doctors determine if a patient has Menetrier's disease? Basically, according to the National Organization for Rare Disorders, Menetrier disease may be suspected in individuals, of course, who have large gastric folds. Why? Because the ridges in the stomach lining are enlarged. Just follow along with me so that you can understand what's going on. So, large gastric folds may be diagnosed through radiologic study after a patient consumes a barium or barium solution, and that's done by an endoscopic exam. So through an endoscopy, there's a flexible tube that is put down the patient's mouth, passes the esophagus, the trachea, goes down into the stomach area. And it's used with a camera to examine the stomach. And if need be, doctors are allowed to take a piece of the stomach out and then perform a biopsy. So that is how, that's one way that it can be diagnosed. They can also have CT scans and blood tests. But to diagnose this specific rare disease, you're going to need a endoscopic biopsy. Next, let's talk about clinical manifestations. First, I just want it to be known that the cause is unknown. There is possibly inheritance and genetic links that are linked to this rare disease, and it has been found that this disease is more common in men than in women. But the symptoms include, so the most common symptom of Menetrier's disease is it's upper middle region stomach pain, so epigastric pain. So we're looking at right in here, right at the top of the stomach midline. Other symptoms include weight loss, nausea and vomiting, GI bleed, diarrhea, edema, swelling in the face, the hands, the legs, the chest, malnutrition, and then low levels of protein in the blood and anemia. For treatment, they can be put on medications. They can have IV protein. They can get blood transfusions and surgery. Let's back up. Why would these patients need IV protein? Let's not forget, the protein from the blood is leaking into the stomach. And then why would they need blood transfusions? Because one of the symptoms for this disease is anemia. We need to replace the protein and the blood in these patients because they're losing several different things needed to keep the blood healthy and fusing to the rest of the body. Some medications that these patients can be put on per the National Organization of Rare Diseases are anticholinergic drugs, acid suppression therapy, antibiotic therapy. So it is directed against H. pylori infections. In some cases, the doctor may recommend a high protein diet just to combat the protein loss. And albumin transfusions may also be used to replace the albumin loss. There's a medication called Erbitux, and it's an infusion block for the epidermal growth factor receptor, and it's been successful in some patients with menetrier disease. It's so rare, it's almost like there's not enough to go off of. In some severe cases, however, some patients do need the removal of their stomach, and that is referred to as a gastrectomy. So for the nursing process, let's go through it. So as assessing the patient, what are we going to look for when they come in the room? And they're in there. We're going to look for weight loss, malnutrition, edema, nausea, vomiting, upper midline epigastric pain, abdominal pain. We're going to look and see if the patient's protein is low in the blood. Diagnosing. We're going to get a endoscopy done. We are also going to biopsy parts of the stomach, test the blood. We may need a CT scan to check and see if the abdomen internally, if the ridges are enlarged. Planning. We are going to plan. The doctor is going to say, hey, this patient is going to be put on this medication. They're going to eat a high protein diet, and we're going to make sure that the protein in the blood is going up. From there, if the plan is in place, we're going to then implement. Let's say during planning that patient was malnourished, and maybe that patient needs a TPN, a total parental nutrition. And some patients do. And that's where the TPN is a method where IV liquid food mixture it goes through a special tube into the chest. That's how we would implement that, and we would assess and evaluate if that patient's malnourished or if their protein is low in the blood. Let's follow up. Let's evaluate. Is the protein levels increasing? Are they gaining weight? Are they becoming more nourished? Is this patient edema decreasing? Maybe a part of the plan also consisted of diuretics or something of that nature. When providing care, interprofessional care to these patients, we want to make sure that we let them know how rare the disease is. This isn't common. It's rare. So diet, eating, it has not been proven that this is preventing or causing menetrier's disease. And sometimes healthcare providers will prescribe high protein diets to offset the protein loss, but sometimes the malnutrition can just continue. Let's go back to if a patient has a TPN. What is something we want to do as a nurse to make sure that this patient stays infection free? We want to take care of the chest port entry, the dressing. We want to make sure it's intact. It's not infiltrated. It's showing no signs and symptoms of infection. We want to make sure that when caring for these patients, we're providing a nemesis basin. Maybe they're having nausea and vomiting. We want to make sure that they're eating high protein foods when under our care. We want to encourage foods. And we just want to make sure that we are letting them know, again, this is a super rare disease, so there's not much that is known about it, but what we do know has been successful in some patients. So basically, let's just comment quickly on the medication Erbitux. This can help improve the quality of life, and it restores acid production, and that's just according to the National Organization of Rare Diseases. So we talked about the pathophysiology, diagnostic tests, clinical manifestations, caring for these menetrier disease patients, treatment plan, talked about a common medication, and then we talked about ADPI and how we'd apply it. We also would always want to provide any type of pamphlet information or anything of that nature that the patient can take home so that they can remember how to keep the plan in place so that when they come back to us, we can evaluate them and we can see improvement. Thank you for your time.